I'm delighted to be here to do a TED Talk today to talk to you about cryoablation, the future of breast cancer care. I'm Ingrid Edstrom, and I'm a family nurse practitioner with an additional master's in health education. I've been in practice for 40 years now, and for the last 13, I've been working with thermography here in Eugene, Oregon. Now let me show you a slide on thermography, if I might. The slides that you see here are a normal thermography on your left and a woman with breast cancer in this area on the right. And what I found is that the thermography is looking into the future, and it'll find things 3 to 8 years before the mammograms will ever see it. My excitement today is to talk also about cryoablation, which is an alternative to surgery, and it can be used for other breast lesions besides cancer like fibroadenomas. Let me tell you a little bit about the process of cryoablation. It utilizes extremely cold temperatures to produce targeted tissue necrosis or death of cancer cells. Necrotic tissue is resolved over time by the body and replaced with healthy tissue. The most common uses of cryoablation at this point are for tumors in the kidney, liver, lung, bone, cervixes, which they've used as standard of care for freezing cervixes for 40 years, prostate, and now breast cancer. The advantages of cryoablation is that it is shown to be more effective than traditional surgical excision. Lumpectomies are only 62 to 80% effective, and the cryoablation is 100% effective in complete tumor ablation or freezing and killing within the ablation zone. It has a quick turnaround, a 30 to 45 minute procedure. It's ultrasound guided, so it's easy to have in your office. It's minimally invasive, and it conserves the breast shape. It's shown to not adversely affect mammogram or ultrasound interpretations afterwards, and has excellent cosmetics. You only need a 3 millimeter incision regardless of the tumor size, where they're able to insert the probe to deliver the liquid nitrogen. It requires only a little bit of local anesthesia, like Novocaine, and the patient is awake during the procedure. A woman only needs 1 day of recovery time or less time off from work than traditional therapies. So now let's discuss cryotherapy, the procedure. In the top slide, you have an ultrasound with a gloved hand, and the tumor is sitting here. They put Novocaine into the breast. They insert a probe through this 3 millimeter incision. There's a red button for freeze, a blue button for stop. You push the blue button, liquid nitrogen comes down the probe and starts creating an ice ball inside the tumor, and it extends 1 centimeter all the way around. You pull the probe out, put a hot pack on, and a half an hour or 45 minutes later, the lady leaves to have lunch, and you've cured her breast cancer with a 92% to 100% effectiveness in tumors less than 1.5 centimeters. Breast cryoablation is the new future in breast cancer treatment without surgery and the early freeze protocol, which was my idea that we created. I presented my infrared slides of a woman named Mary, pre and post cryoablation, using my thermography camera. Laura Ross Paul and I were invited by the Chinese government to present my slides and the early freeze protocol on July 2nd, 2016 at the 5th International Forum on Cancer, Cryotherapy, and Immunotherapy at Fuda Hospital in China to over 200 physicians and international researchers. It was incredibly well received. The presentation was called the Early Freeze Protocol, and you can see the whole video on my website, protectyourbreast.com. On this slide, this is Mary pre-cryoablation. In this circle, there's a biopsy-proven cancer that's 1.5 centimeters. On the grayscale imaging, you can see that there's blood flow or neoangiogenesis leading up to the tumor that I can see on the thermography camera. This is Mary when she came back 8 months post-cryoablation. Between the 2 pointers here, she has the immune effect that's occurring, which is actually 6 centimeters by 4 centimeters. And you'll notice that it's very cold in here. There's no heat because this is done on a Celsius scale. Dark blue is cold, light blue is warmer, greens, yellows, and oranges. So it has a cold, big, spongy mass that on the grayscale, there's no blood flow leading to this. So the immune effect, what it does is it's as though you have an injury on your palm, where your palm gets big and angry and puffy and pus coming out of it. And that's the immune effect, because your body is sending out white cells and cytokines to eat up the infection in your hand. The same thing is really happening in the breast for the immune effect, because the white cells are going after cancer cells and they can find it anywhere in the body. Here is Mary that she's reappeared 2 years post. That big area of spongy tissue, 6 centimeters by 4, has shrunk down 80%, and all she has is a little bit of cold, dead scar tissue here. This was, to me, absolutely miraculous. Here is another MRI of a active breast cancer with the contrast lighting this up. This is what they call the cryoablation halo, and you can see that there's no active tumor here at all. And this and several of the other clinical studies were done starting in 2003. My new book is now out, To Protect Your Breasts, Freeze and Cure Your Breast Cancer, and to reduce your risk of breast cancer or its reoccurrence. So I really appreciate you having me do this TED Talk today, and here's my contact information. I'm trying to bring cryoablation equipment to the Pacific Northwest, and I also want all women and doctors to know that they have another option beyond surgery, radiation and chemo. Cryoablation is the future of breast cancer care, and remember, prevention is the cure.